So good afternoon, everybody, and welcome. It's 2023, start a whole other year. So I take it that everyone has the agenda, okay, and has the November minutes. And before we get started, I do want to provide our notice that this meeting is being recorded and will be available for viewing on the Judicial Branch YouTube channel. And we're calling the meeting to order at 2:03. And before we really get going, I do want to go around. Rachel is new for 2023, and so I do want to go around and do introductions. And I'm going to just kind of look at my screen. Actually, you know what? I'll go it this way. So we'll start. I have a list. Got to make sure we have a quorum, you know. So let's start with Brittany.
Good afternoon, everybody. My name is Brittany Kaplan. I am, the legislative liaison for the Judicial Branch.
Thank you, Brittany. Robin?
Hello, everyone. Rachel, welcome. I'm Robin Towsey-Ayers. I'm from the Office of Injury and Violence Prevention at the Connecticut Department of Public Health.
Linda?
Good afternoon, everyone. Linda Cimino, Office of Victim Services.
Natasha? Oh, you're on mute, Natasha.
Hi, Natasha Pierre, State Victim Advocate from the Office of the Victim Advocate.
Thank you. Danielle? Oh, I'm sorry, Marielle. I'm sorry, what is your last name? Sorry, Marielle.
It must mean me, because sometimes that happens with my first name and my last name. Hi, Marielle Daniels, Connecticut Hospital Association representative.
Thank you. Beth?
Good afternoon. I am with the Connecticut Alliance to End Sexual Violence. I am the ED here.
Yep. And Kenesha?
Good afternoon, Kenesha. I'm the Deputy Director at the Connecticut Alliance to End Sexual Violence.
Do we have Dr. Cordiano? Don't believe so. Okay. And Heather is not here either. Rachel?
Hi, everyone. My name is Rachel Henderson, and I am the current Connecticut chapter of the IFN president. Nice to meet you all.
Thank you, Rachel. Welcome. Sherry?
Hi, everyone. I'm Sherry Watson, and I'm the representative from the Connecticut Nurses Association.
Thank you. Mary?
Good afternoon, everyone. Nice to see you. Mary Kazicki, Deputy Director with the Office of Victim Services.
And Jean?
Hello, everyone. Jean Weisbrod, Administrative Support, Office of Victim Services. Nice to see everyone.
And I want to thank Jean, who is taking minutes for this meeting. Did I miss anyone? Okay.
Myself. Oh, sorry.
I'm sorry, what was that?
Yeah,
I'm sorry, Amanda. Amanda, my apologies.
No, it's okay. My name is Amanda. I'm also with the Connecticut Alliance to End Sexual Violence. I'm the Sexual Assault Kit Initiative Victim Notification Coordinator, and I'm also the Training and Outreach Coordinator.
My apologies, Amanda. Welcome. So good afternoon, everybody. For those of you who were here for the November 9th meeting, we need a motion to accept and a second to accept the minutes.
So moved.
All right, Marielle, second?
I'll second, Sherry.
Okay. Any discussion? Any corrections, edits? Okay. By show of hands, for those of you who are on camera and on the chat, if you approve the minutes, just raise your hand. And in the chat. Okay. All right. Approved. Okay. Going to ask Robin to give an update on the pamphlet, and Robin, just can you, because Rachel and Amanda are, I think, a little on the new, weren't here at the beginning of our discussions on the pamphlet. Can you provide just a very brief background to it as well as the update? You're on mute.
That's what I do
Yeah,
to
there you go.
myself. That's what I do in the car so I can't hear myself talking to myself. So, Rachel, in a nutshell, the victim services brochure is legislatively mandated. We can send you the act, et cetera, of why, why we're doing this. So, and the legislative mandate directed the Connecticut Department of Public Health in collaboration with the Connecticut Alliance to End Sexual Violence to oversee this. So that's quickly in a nutshell. We can send you the link to the legislative act and you can read all about it in your leisure time. But it's very important. And there has been a previous version of the brochure, gosh, that's been in existence since, I don't know, the year 2000 or earlier. So we decided it was time to update it. So that's what we're working on for months now.
Thank you.
So-
And I do have it up, by the way, when you're ready for me to share.
Okay, so
I do have it.
Okay, so just to update everybody, and I apologize this has taken so long. I won't get into all the details except being short-staffed. Short-staffed. It's very hard to accomplish everything that is requested of us. So I do apologize for that. So we have a vendor who's working with us on the design, and she can't be on today, Lori. So I am going to mastermind this myself. Anything that leaves the Department of Public Health has to be approved by our Office of Communications, which just prolongs everything that happened. So our Office of Communications went through the last version of the brochure, and I also, I'm afraid I'm a red pen fuss, but I do want it to be correct, because if it's not, people will nitpick at us, all of us. Oh, this wasn't right and that wasn't right. So, so this is the current version. If you can just bring it up. Most of it is just editing details, which I feel is important for you all to do versus me. So, because I know you're very dedicated to what you do. So I just, on the cover page here, this is my comment, food for thought. You can see that there's an older adult in that picture using a walker and having a personal care assistant with them. I just, in terms of visually, think about not all older adults are in this situation. So, like I said, food for thought. I know we've been through some of the other pictorial graphics. So anyway, so that was that. And I want to leave this, we can't go through everything. I'd rather leave it for you to go through yourselves and correct. So if you can just keep scrolling.
Sure.
Okay, down here where it says yellow, if you stop at the yellow, go back up. Scroll
You want me to go
back
back up right here?
Yep, right there. So where to get help? I'm asking the questions. Do you want it to say where to get help versus who or how to get help? Just for language. Keep going down to the next yellow. Here is just a minor detail. It should say the Connecticut Department of Public Health, because there are lots of departments of public health. You just want to recognize that it's Connecticut. At the next one where it's on yellow sex, I have a comment. I don't know if you can see them. The comment there includes the word disability. So we're sure that we're including them, and think of any others if we have left others out. Next one says the statewide hotline. Do you want it to say statewide versus Connecticut? And you can see their comments on all these yellow. It's a PDF, so it's kind of a little bit
Some of
hard.
that too, I'd love to update. There's a little bit of, like, it's a little bit the messaging components. I'd love to just have the opportunity to clarify, because I think this might be a little confusing to folks in terms of how to access those services.
Sure, that's okay. Let's see, the next one, closest to you. Why did I put that in there under member centers?
In Connecticut.
Oh, you can read it? Okay.
Yeah,
Thank
it's,
you.
yeah.
Okay, I can't open it from my, okay. So, all right, so closest to you in Connecticut. So the next one is same thing. It says convenient locations, and I just put a comment in there. Do you want to say throughout Connecticut versus just the state? Let's see. The
Do you want me
next,
to keep scrolling?
yeah, the next one down is under risk of sexually transmitted infections, including HIV. Minor detail where the yellow says, should that be infections plural versus singular? Sometimes I think I should have been an editor. So the next one down is under pregnancy. Again, this is just a grammatical thing. I have, instead of 2 women, you want to say 4 women. Next is the follow-up care, the chart. And you can see in the comment I have just put sexual assault forensic medical exam or sexual assault forensics exam with a SAC. I just, I'm taking this from your script, so I just want to be sure we're complete. You don't have to correct it now, but just so I put it in there. Next is STIs. I just put in sexually transmitted infections, spell it out, and then with the abbreviation. Next down is pregnancy. Do you want to say pregnancy testing there? And then in testing timeframes, under PEP, I just spelled it out, post-exposure prophylaxis, PEP, and then pregnancy testing timeframe. When it says 2 weeks after assault, I have a question in there. What will that tell you versus you're already pregnant at the time of assault? I don't know if that needs to be further clarified. I don't know if you go after the DNA more after 2 weeks. So that was just something I saw. Then we can keep going, continuing the ongoing care you deserve. In the second paragraph, a link, where it says connect with a provider. I put healthcare provider. Is that what you want in there versus all the above provider? Okay. Next one down, 1, 2, 3, 4, fourth paragraph, not being believed or blamed for the crime. I also put in there, do you want to use the word or stigma in there, or is that something you'd rather not include? We still on the same one? Yep. Okay.
Yep.
Okay.
You want me to keep going?
Yeah, know your rights. Where you have, if you choose to seek medical care after do you want it to say sexual assault so it's consistent? And then I just, again, food for thought. I thought, do you want to have the one that says you have the right to have a certified sexual assault counselor advocate at a hospital with you to be the first comment so they know right away, right off the bat, that that's a possibility. So let me just Are you, okay, you're still looking at the same one. I had two versions. Okay, so, and then a lot of it is just making sure it's consistent. The second one, you can stop the exam. Do you want it to consistently say medical forensic exam in the next two also? So it matches the first one. And then on the second to last one, again, do you want it to say a sexual assault versus just an assault? And then on the last one, and I don't know this, it says your privacy are protected through the state, which can protect. Is it can protect or protects? Is it an if or a for sure? So that was just that. Then down covering the cost of health services, even the number 2, even though the assault, you want to say sexual assault. Then down in the blue section, Planned Parenthood of Southern New England, do you want to say which includes Connecticut? Who knows, it might be confusing to some people, Southern New England. And then health insurance next, you don't have to capitalize health insurance. It's not a company, you're not referring to a specific one. Next is you may be eligible to receive compensation for some of the expenses you incur versus incurred because it's an ongoing situation. Next one is Connecticut Office of Victim Services. I just suggest you put the abbreviation in there because you use it down below. And then you move into Sexual Assault Crisis Service Centers. I don't know if you can you see my comment? A person told me this years ago and I've always remembered it. Service centers are for cars. So I just put that in there as food for thought. And then you've got a spacing issue here in the service center sections. Maybe if you decrease the space here, it'll help down below. Like maybe, you know, our Lori will have to help us with that. As you can see, we've got the QR codes in for everybody. So we're, you know, historically up to speed. I still can't figure it out when you go by a restaurant and they don't have the menu posted on the window. They have the QR code. I'm like, what? So I'll just quickly go. I went through the first couple pages of this. I think we need to really go through it and make sure the names and all the linkages are correct. For Planned Parenthood, do you want it the National Planned Parenthood or the one for Southern Connecticut? Next down, I went and looked at this, the Yale New Haven Hospital. This community healthcare van isn't really a function of Yale New Haven Hospital. It's actually listed under the School of Medicine. So if you can go in, I put comments in there so you could see, so you could go in and make sure that it's correct. Then the next one is Bridgeport Health Department. You'll see I went in and looked at that. It's actually their communicable disease clinic. I don't know if that's casts an aversion to use that language or not when you're referring somebody somewhere, but that's how it goes by. GBAP, just putting the full terminology. The Center for Family Justice, I went on their website. They actually have a link that takes you to sexual violence. So I dropped that in there. I'm not sure how you think about the websites, if you want the organization's website or the website that would take somebody right to their sexual violence services. Then, you know, Apex is not all caps. It's A and then PEX lowercase. So just, I mean, I just went through the first couple ones. I just don't have enough time to go through everything. Maybe somebody in one of your organizations could go through and check these. So we make sure they're, because these are the kinds of things people will nick us on in a heartbeat if they're not correct. Even, if you go down to the Hartford Health Department, that link, I was blocked by security. So you'll see up above, I went in and found a website link that I could go in on. So anyway, I went as far as I could before it was time for me to cut away to come to the meeting. So hopefully.
Robin, is this the end of it then? Is all the listing?
Yeah.
Okay.
Go all the way to the end, actually, the last page.
I can. We go.
Okay. So you have sexual violence. The title of this page is Sexual Violence Information and Services. Is that what you want, or do you want it to be consistent to say sexual assault information and services? And then down at the bottom of the page, there's a number. I don't know what that is and if that needs to be there. So that was my English class for the day. So, I mean, if you guys, most of these comments are for your opinions. So if you can go through it and make those comments or corrections, that would be great, because now it's gone through DPH. So if we just make these edits, we're pretty much good to go.
So Robin, do you want me to, because I've just shown this, do you want it to be sent out to the committee members to review?
Well, I wish it said draft on it. I don't like to send it out that way, but I couldn't figure out how to put draft on the PDF document. Does anybody else know how to do that? I can ask internally at my office, one of the younger, smarter, more.
Is there a way to do a watermark?
Right, that's what I mean. Draft watermark on it. Yeah, I couldn't figure it out.
Google's saying there's, oh, sorry. I was just going to say, Google says there's a section called Choose Tools, Edit PDF, Watermark, Add. And then that's how it gets added. But I'd love to do like a little focus group here at the Alliance just to look through this and edit through. So if a draft of it could be sent over digitally, then I think we'd like to send edits over too.
Sure. Let me find out inside somebody inside DPH surely knows how to get that watermark on there. I went quickly through tools and tried, and I couldn't figure it out.
So Robin, if you could, work internally and send that over to the Alliance. So Beth, I'm thinking that you want to have a little work group
and
to review it.
Amanda's, this has been an ongoing project for a while, just so Amanda, for your edification, we did provide a lot of the content originally and went through some versions of it, but I'm really happy, Denise, to your point of having us go through the sort of fine tooth comb point, and then also to just talk about, for me, I think some of the questions around point of access, I would rather put it not just the general website, but to the actual place where somebody could seek sexual assault services. So we can go through in our centers and make sure that the actual, all of that is correctly listed where it makes sense, and then just tighten up any of the language pieces that we see.
I apologize for being such an editorial fuss.
I was an English major also, and loved being an English major also. So you are me. No worries, Robin.
I have and as a formal journalism major, I totally understand it too.
Yes, I have two close friends that work for publishing houses, so I hear from them all the time.
So Robin, you're going to get that watermark on there and then send it to Beth. Would that be correct, Beth, or should that go to Amanda?
Or any of us here, it can come to myself, Kanisha, and/or Amanda. Will all work. Whoever gets it will work collaboratively here as a team.
Great, thank you. I'm sorry it's taken so long, but
That's
If
okay.
it's
We'll
not-
get there.
I know. If there's even one mistake, we'll hear about it. I know it.
That's okay. We'll get there. And then Beth and Amanda and who's on? I'm going to mispronounce. Not
Kenesha.
Shakira.
Kenesha.
Yes, thank you. My apologies, but I'm kind of assuming that you all will work together, and then maybe with the March meeting we can come back with what we'll hope will be the final version.
We don't have to wait till March. We can meet ahead of time to go through what the Alliance has come up with.
No, I was thinking of for the next Safe Advisory Committee meeting.
Oh, okay.
Yeah, because what we'd like to do is really wrap this up and have it available statewide, and then we can work, as we talked about at some of the previous meetings, to actually have a statewide discharge packet, which I know a lot of people are waiting for that to happen. So, any other comments, questions? Okay, Linda, I think you're up on the website.
Hi, everybody. Nice to see you. Hi, Marielle. I am happy to say that the majority of the information that have been provided to individuals interested in the SAFE program is now available on the Judicial Branch webpage under Careers and Opportunities. I would very much like to thank Melissa Farley and the Judicial Branch Web Board for turning this around in such a timely fashion. The page is not totally finished yet because I still have some work to do to add additional information, but the majority of it is up there. And so anybody who's interested in the program as far as joining the program as a SAFE, they can now reference that page. And Sherry, you know, you've been so great in helping us do those email blasts to raise interest. Yeah. Now we have a natural place to point them. So it's very exciting.
Linda, do you want me to bring it up?
That'd be great.
Let's see here. There you go. So, Linda, I just brought them to the main page. And then I'll go down and just, you want to walk them through it?
Yes, Denise is clicking on the Sexual Assault Forensic Examiners Program. You link on that. Click on that, and there is the information. It was interesting. Denise and I worked on this because, Robin, to your point, and I am also an English major, was an English major, and I'm known for my editing. But it was interesting on this because Denise has over the years created several documents, and in order to do a website like this, it all has to be one-voiced. So that took a little time, but I feel very thrilled that this is now available to any medical professional who's interested in the SAFE program and see if they qualify. So I'm hoping by early February, the rest of the information will be added. And I would go through the relative sections, Denise, but it's so small, I simply can't see it.
Oh, sorry about that.
That's okay.
I don't know if I can make it. Let's see if I can make it bigger. Ah, look at that. Is that big enough?
That is. So you can see we start with what is the Sexual Assault Forensic Examiner. And then because our initial focus was getting the information up for anyone who's interested, we went through the very first piece here. Pieces here are all relating to the training program. So we wanted individuals who came to here had a really quick, easy to access overview of the license requirements to become a SAFE, and what the training is, the thoroughness of the training, the time involved in the training, the fact that it is accredited, and that went through the time commitments. So if you, and I hope everyone outside of this meeting goes and looks at this, but it's really very much focused on the class and then explaining what the medical forensic examination is. So I'm thrilled. And I guess as Denise continues to scroll, we've taken pieces of the RFI, which any interested medical professional has to complete in order to be considered for admission into the training program. But by adding it here, they understand what once they've successfully completed the training, what the reimbursement rates would be. So we tried to provide a full look at what's it take to become a SAFE, and once you are a SAFE, what can you expect from the program? So, like I said, I'm very happy with it, and I'm hoping by beginning of March, the remainder of the information is up and posted.
And Linda, I believe they said, excuse me, the web board said that when the RFI or the contract, the application to apply for the SAFE program, they said they could embed it right in the website. Yes? That's correct. Yeah. And that's partly one of the reasons why it's under careers and careers, jobs, and opportunities. We thought that would be, it's 2 clicks away. So it's very easy to provide brief instructions on how to find this information. So hopefully that will save a lot of, basically it'll make everything much more efficient. And, you know, Sherry, I'm not sure if I told you how many inquiries I actually got. It was close to 300. Wow. Which is, and of course I had to answer each and every one of those, and that takes a lot of time. So hopefully I can just redirect to the website, and of course we can add to it, change the course dates. And the one thing I will note that this website is specifically geared towards the SAFE program itself and coming into the SAFE program. It does not, what it does not do is talk about those who are taking the course for their hospitals. It's not really geared towards that. It's really more towards steering people towards the SAFE program itself. Linda, did you want to add anything else?
No, I think that pretty much, it's taken quite a while, but I think the outcome is really good. And when the rest of it's finished, we'll send out an email to the committee to let them know that it's up. So anybody you come across who's interested, thank you, Marielle. Please point them to this website.
Yes, 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 yes. Any questions or comments?
I think it looks great. And I think it just, when I was quickly looking at it from the nurse's perspective, it's going to provide a lot of their questions quickly. And I think it would actually entice some other people, like saying, oh, this is what it's about, that are really invested in doing it. So.
Yeah, and that I think will be a huge help going forward. So as far as the SAFEs in Connecticut update, we just finished the fall class as well as all the program orientation. And one of the things I will share with you, and Mariel, I have not sent this to you yet. It needs to be kind of polished up just a little bit. But this is actually the list. And what you see is at the front of this, Denise Poncini, who's not able to be here, she's been our legal person to lay eyeballs on this, if you will, and kind of sort of go through and correct it. And so this part up here that basically is in statute as to what a SAFE is and who qualifies for being a SAFE. You'll note that these are the following healthcare providers that are qualified to practice as SAFEs in Connecticut who have met It's actually should be certificate requirements, including continuing education requirements. And it's just simply a last name, first name, and if they're board certified. At this point in time, that's at 137 safes in Connecticut. What this list does not include, it does not include those who took the class since the inception of this program, since 19114, the Public Act. A number of folks, probably around 30 or so, I have not counted exactly, have indicated to me in writing that they are not practicing as safes. They do not want to maintain their certificate. And those are not included on this list out of respect to their request. And some of those requests come in as a result. Let me stop sharing here. Some of these requests have come in because they've become travelers and they're working in other states. Some of them have retired. Some have changed careers. Sadly, we've actually had 2 pass away. Some have indicated that, unfortunately they've got medical problems and cancer has been cited in several cases. And so those folks are not on this list out of respect to their request. Otherwise, the people that are on here are all the people whose certificates are current, and also who are currently attending the annual, well, it's actually more than that because not everyone did attend the annual competency day this past year, and are choosing not to pursue their certificate, but their certificates are still current. Those are included on this list. And so we'll polish it up. The one thing that we really wanted to talk to Denise Poncini about including was the expiration dates, or if there's anything else that should be included before I actually turn that list over to the Connecticut Hospital Association. But the list is up to date as far as I have it to be. Does anybody have any questions about that? Okay, so just kind of sort of to wrap back around to how this is going to be housed and who has access to it. Originally, it was going to be housed at the Department of Public Health, but it would have been public and anyone could access it. We kind of wanted to protect privacy a little bit. And so the Connecticut Hospital Association will be housing this. And it will only be provided to hospitals who are inquiring, and also to safes and nurses who might be wondering, is their name on the list, or why isn't their name on the list? Because you always want to make sure that it's correct. I do know, for those of you who are on the Alliance, I have had at least one question from the Alliance, from an advocate, about someone whose name was on the list, and I unfortunately had to say I can't provide that information. So it's not going to be public. It's just going to be to those 2 groups, unless there's a reason.
Can I just clarify too? I think you sort of said, you said CHA would house it. I mean, we're not going to necessarily house a list. You're going to supply it to us. We'll provide it to direct contact we have. We're not going to put it on our website. And
no.
And we won't release it to anyone other than our own membership. So I just didn't want anybody to say, hey, Marielle.
Sorry about that, Marielle. No, but we want to protect everybody's privacy. But we also want safes who legitimately should belong on that list, to make sure that they have the right and the ability to access it and to verify that they're on that list, as well as hospitals, because nurses, they move around a lot, and if they have safe on their list of qualifications on their resume, and a hospital wants to check that, we want to be able to provide them with that ability to verify. That's the purpose of the list. It doesn't go to attorneys, it doesn't go to prosecutors or defense attorneys or anything like that. Does anybody have any questions on that?
Denise, if I could just for a second, I think this list is very easy to look at and, you know, take in the numbers. I'm not being very articulate, but I just think it really bears to be noticed and referenced how many people this program has trained and how many safes have stayed with it either through their hospitals or here. And Denise, I really do think you should be commended for really all the years here, but also all of this training was very much in all the annual competency days. It's a Herculean lift that you've done. And I just, with this list of 100+ people, I just wanted to recognize that. And Natasha,
Well,
I'm
thank
sorry,
you.
I probably spoke right over you.
Natasha, I see your hand is up.
Okay, no, you didn't speak over me. Yes, this is a wonderful project. I'm glad to see it's at this point where the information is up and easily attainable. One thing I just wanted to point out is if we're keeping that list private, I don't know if this meeting right here is public, but we need to go back and do something about that page that we showed if we're trying to keep it private. Okay?
Yep. Good
That's
point.
the victim advocate speaking.
No, that's okay. I'm glad you pointed it out. Glad you pointed it out. But in any case, so we will have that list, and that way the Safe Advisory Committee, which regulates safe practice, can kind of sort of monitor it. So any questions on what we've talked about to this point? Okay, so new business. Does anyone have any new business? Any topics they want to bring up? Okay. Hearing none, I'm actually going to bring up new business, and it's going to kind of carry us through to the remainder of this year and probably beyond. For those of you who don't know, this is my last year in this position. I will be retiring. Yes, I'm retiring in December of this year. I am actually going to go dig in the dirt for a while. Going to grow roses and flowers and things of that nature and enjoy my granddaughter. Yes, I'm a new grandmother, for those of you who didn't know. So the kind of sort of the long range goal of this committee and of the SAFE program, I should reverse that, the SAFE program and the committee, is really way back about 12, 13 years ago, a group of people who started out at what was then called CONSACS began a meeting and, well, thank you, Rachel, began to meet and wanted a statewide response SAFE program. Of course, you know, sometimes best laid plans go awry. It didn't go statewide. It's not statewide, although we certainly have, we currently do have 31 nurses in the program, 13 of whom are precepting, and we just had another 10 who accepted positions. So the program is growing. And but the questions on the table are going to be the conversations of this group in this next year. And the questions, and we can certainly put this in writing to you, but specifically, what should be the goals, short-term and long-term of the SAFE program? And I'm talking about specific goals. What's the vision for this SAFE program? Is it still a statewide response program, or should it should the nature of it change? What should the SAFE program look like in 5 years? I've been here for 12. Look, you can see what it looks like. What should this program look like when the goals are met? What investments should be asked, if any, from hospitals who benefit? And how should it be staffed and by whom? What are the actual staffing needs? Should there be an expansion of the role? Should this, I recently had an inquiry from the Connecticut Coalition Against Domestic Violence about changing statutes to include domestic violence. Should there be diversification of the role? And what are the barriers to achieving these goals, and how do we get past the barriers? And not just for the hospitals that we are currently responding to. It was never intended to be limited to a third of the hospitals in the state. And this was one of the things that and I'm sorry she's not here, Dr. Cordiano brought up in our last couple of meetings is, how do we get hospitals more invested? How do we get this out there? And we're not going to answer that in this meeting, but rather these are going to become, this is going to be the agenda going forward. Yes, we're going to wrap back around. We're going to tie up loose ends with the pamphlet, with the website, and with that list of safes. But this will be the agenda and the mandate of this group. So now I want to hear your thoughts on what I just said. Y'all can come off a mute.
Well, Denise, first of all, congratulations on your new granddaughter.
Well, thank you.
And it is the first I'm hearing that this is your last year, so I'm still in
sorry, Mary.
denial right now over how
I didn't know who knew and who didn't know.
But I do think you're right. I mean, I think the next phase of this group should start looking at long-term goals for the SAFE program. I would say on behalf of the hospitals, we still want to see it go statewide. And I do hope we can somehow figure out as a group the best way to approach that. I do think one of our biggest challenges, not just this year, but in the next several years, and we've already alluded to this in our last few meetings, is healthcare as an institution right now is suffering across the board as far as staffing. So it's hard even for hospitals to get invested, in anything other than even just our own staffing nightmares. But on top of that, how do we help this program grow so that we're all, benefiting from a statewide response is going to be a challenge. So those are my thoughts initially, but I do agree. I like all the things that you highlighted that I think as a group we need to start focusing on and getting some ideas around what we want to see.
Yep. Thank you, Mario. Yeah. Other thoughts?
Denise, it's Sherry, and congratulations on both. I know this was new for me too, hearing that, and lots of retirements I feel like are in the future in Connecticut. And you'll be very much missed. I think, but this is a good time to review, especially Mariel, as you said, the healthcare has changed from a few years ago, and this would be the time to also maybe do some focus groups. We brainstorm a few ideas and then bring them back to maybe the hospital and to a pocket of nurses, non-sane or sane. Like there's just different ways that we could tap into doing some focus groups after we brainstorm ideas that still support the victims and still support the goals that we can't compromise on. Things like that. So it's going to take time. So I'm glad that we're having that opportunity to do that, over the several months.
Yep. Thank you, Sherry.
And I know I'm preaching to the choir, but just to kind of reiterate the importance of this program and wanting to be a part of this conversation, because prior to coming to the Alliance, I was an advocate. So I remember walking into hospital groups and how the interaction or the experience for the survivor changed when there was a safe nurse and an advocate. So making sure that, not even just maintaining the program, but growing it and getting more hospitals on board, because the experience is vastly different when both of us are, in that room together.
Yes, I mean, we really, it's such a beneficial thing to respond with advocates. One of the things, it's one of the things I've wanted to do and just not had the time to do is to copy and paste all the wonderful comments that our SAFEs have made about the advocates over the years. You know, the value of working together cannot be overstated. It just cannot be.
The other thing that I would love to see us do is, like, you know, our partners in North Carolina, one of the things they did is they went after the Attorney General and got, I think, an additional $2 million allocated to have more safes in the state of North Carolina. And there it's a real problem in terms of rural coverage, right? A lot of the communities that are rural just don't have access to medical care, period. But I think I've been at the coalition the whole time, right, since this program started. And much like our colleagues have said, we also have always hoped that it would become a statewide program, because we really do not only see the emotional value, right, for survivors to have that, but we also see better outcomes long term for those cases through the criminal legal system. And I think that there's a way in which, over the course of the pandemic, and we historically struggle with this also, like, you just more and more we are losing ground, and we are losing faith in a system to hold folks who cause harm accountable and to have good outcomes for survivors. And I think that this program, right, if it goes away all the way, right, you're just going to see more and more of that. You will see the sort of ripple effects of you know, our inability to work collaboratively to meet the needs of survivors. And I also just think in Connecticut, we have not made meaningful investments, right, in the area of supporting sexual assault victims. Like, I heard you a few minutes ago talk about domestic violence and wanting domestic violence folks to be part of this process, right? Like, there is a disproportionate response to domestic violence in the state of Connecticut that we just do not see for victims of sexual violence. And so I really hope that we can identify ways not just to keep the program going in some fashion, right, but to really be able to grow it in the way that it is intended to be. And some of the other states around us who have been able to do that, they consistently just see better quality of care for the survivors who are going through. And it's also good. It does not matter, right, in terms of, like, the investment is a worthy investment, right? Like, meeting the needs of victims of crime and meeting the needs of survivors of sexual violence is a worthy investment by the state. I think we have to maybe do a better job of sort of calling folks' attention to that and trying to identify places where you're putting a huge amount of resources, right? Maybe slicing off pieces of those pie allow us to put money towards some other things that also support victims of crime and violence.
Yeah. One thing I will add, and this is really thanks to Sherry, that you know, we've mentioned it a couple of times, but just to clarify, what happened was that Sherry had the idea of and made the offer to send mass emails out to a couple of different nursing groups. One was the Connecticut League for Nursing, and one was the Connecticut Nurses Association. Now, these are not necessarily ER nurses, and I will tell you that we are seeing a real diversity as a result. We have 13 people who are precepting right now, but one of them is a male, and I've just had 2 other males apply. I have greater ethnicity applying to be a part of this program, and so and they come from different nursing backgrounds. We used to think that you needed to have acute care experience to do this work, and what I'm finding is that's not necessarily true. We have the nurses have changed. The audience, if you will, has changed. So we actually have nurses from education, from public health, who work the floors, who work for ProHealth, who work surgical, who work psych. We have a number of DEMAS, along with multiple public health. In this last class, probably 2/3 had masters in nursing. We have several with doctorates. And these are professional nurse educators who have a real interest in this program. And it's very, very interesting to see. Some of these people have talked about looking what they could do with the research as well. The research driving the outcomes, if you will. and the way to get the funding through outcomes, proven evidence-based outcomes. So it's just a matter of getting them experienced and really getting them going. It's been quite the journey this last year since those emails went out, Sherry. I've learned a tremendous amount. They bring a different flavor. They bring a totally different flavor to the program, and I've had to look at things from a different point of view as a result. So as we move forward, I'm going to take these questions, and please, by all means, send me your questions. If along these lines, you have topics you want to cover, you want to spend time looking at a very specific point, I'm going to send out these questions. Linda had seen them before I read them. You don't have them in writing, so I'm going to send you some things in writing, and these will be on the agenda. And we are going to take a close look at what we can do, not only this year. This year is kind of sort of being a year of change. I mean, Linda, for those of you, anybody who doesn't know, Linda is also retiring in a few months before I do. So there will be change. And but I also think, and I tell everybody this, the future's bright. The future is really, really bright. People just, right now, we're kind of sort of in this valley. But this program, in one way or another, safes are here to stay. Yale, and I know, Rachel, I'm kind of sort of calling Yale out just a little bit. I hope you don't mind. But Yale has been sending folks to train, how many? Six, something like 6 at a time, 6 a class, something like that. Yeah. And they have built a real cohort, and Rachel's been helping to run that. And they've really invested in that. And I think much of what they do stands as a model to others. And so they may have some ideas and thoughts. I know Mark Sevilla has bent my ear a couple of times. But we would like to see the entire state do this. And so what I hope a year from now, I won't be here, but in December, on our last meeting of the year, which I think will actually be November, just 2 seconds, Rachel. And then I'm hoping that we will be much further along in our understanding of what the next steps are. And Rachel, you had your hand up.
Yes, Denise, sorry. Thank you. I just wanted to let everybody know, I'm here as the representative for the CTIFN chapter, and part of what our goal is to help, OVS and the state program and the state of Connecticut is really just get the word out that, forensic nursing is a career. It is a specialty that nurses need to be made aware of. A lot of times I feel like, going through my program, it's not something that's in a traditional undergrad education, or if it is kind of brushed over with a really vague brush, and so nurses don't really even know the opportunities we have to be their bridge between healthcare and the legal system. And so for us this year, our goals as the CTIFN chapter is really to bring awareness to young nurses that forensic nursing is an option, to help build that volume early, so that when they do have the years of experience to attend Denise's program, that we are able to have a robust group that looks to the websites and looks to their institutions, initiate these kind of programs there, because really inspiring our nurses to look for that one-to-one time with their patients. For myself, especially during COVID and whatnot, I'm still at the bedside.
Rachel, I think you just froze.
Patient and providing them the care they need in the moment. And my most rewarding moments have been able to care for those patients that, you know, really are underserved and unheard and, you know, need representation and strength to be able to get through their trauma. So for us at the CTIFN, really our goal is, and you'll be hearing from all of us because emails are going to go out to the different hospitals so that we can come meet your nurses and be able to let them know that the IFN is there to support nurses if they want to transition to, you know, after Denise's program and get their CNA and be experienced and have that international certification, really be the leaders in Connecticut to be able to support other SAFEs in their practice, right? Because really it's one thing to be trained, but then to be out there and not have a support network. The IFN wants to be that support network for the nurses. Like, everyone needs to go through the state program. We've standardized our training. Everyone's going to go through OBS, but how do we support those nurses once they've gone through? That is a task as your numbers start to grow that you're going to need help, right? So training and nurses, you know, in your institutions. I think that going forward, you guys know that capacity is
Rachel, you're breaking up a little bit.
That for you guys, and you need to be feel free to check that. See in the chat. Any support to reach out. But I really appreciate that.
Okay, I think we got most of that. You're breaking up towards the end of there a little bit. But I think everybody heard most of what, yeah. Thank you, Rachel. And what Rachel said is true. I've been a part of the International Association of Forensic Nurses for a long time. And Rachel's absolutely correct. Nurses, once they train, they do need, because vicarious trauma is real. They do need support. Anyone else?
Denise, this is Sherry again. I just had my hand up. I just wanted to say, Rachel made a really good point. So if I can help facilitate, I will. There's an RN student day for Connecticut nurses, for all the nurses, and thousands, a couple thousand now. It's in November. So if you wanted a booth, if you wanted to get up there and maybe make a little thing about the forensic nursing or about the SAFE programs, not everyone stays in the Connecticut. So, but a lot do. So you guys can reach out to me. I will connect you with the CCNW and make that kind of work out. But I'm, you know, obviously it's not till November, but I can work on that for both. And I think it could be for the SAFE program and then for the IFN, like however you want to do it. I'm happy. I could put in my email and I would be happy to work with you guys, like whoever, just to get that word out to the younger people.
That's great.
Younger nurses, I shouldn't say age. I should just say new nurses. I shouldn't say age is new.
We were well once there.
And Rachel, sorry. Oh, go ahead, Terry.
No, that's it.
I was just going to add to Rachel, like, I really appreciate what you pointed out. And if you want any help, like dispersing information out to the hospitals about anything, you know, please feel free to utilize me. I'm happy to, you know, send out stuff to our contacts through the membership. So
I really appreciate that. Yeah, that's our.
Denise has all my info, so just pound Denise for my.
I'm happy. I have Denise's personal cell phone. I can text her if I need to. So
okay. Now there you go. A fruitful meeting. All right. Anything else?
Denise, I'm just wondering, on your education side, you still haven't had any progress on replacing Pat, or?
Not yet. I'm just going to say there. I don't know what the results of that will be, but there is one interview coming up. But and again, I don't know the outcome of that. So, but at the same time, I am going to tell you that regardless of whether I'm here or somebody else is here, you know, safes are going to go forward. There's just the need is far, far greater than any one individual. So it'll work itself. I'm very well known for saying it'll work itself out. So, and I do, for those of you, I know Marielle and Sherry, I do apologize anymore. It wasn't that I was keeping it a secret, but I also wasn't kind of sort of announcing that I was leaving. So, so I was talking to Linda about this whole situation. It's like, well, it's a good time to let people know. So, anything else? Let's make sure that, all right. So our next meeting is on March 8th. You know, you know, you'll see that it's on Microsoft Teams virtually throughout the year. I don't foresee a time that would change. So we will see you back here at 2 p.m. on March 8th. And buckle up your seatbelts because it's going to be quite the conversations that we're in for this next year. And meanwhile, we will wrap up with the brochure. We will wrap up with the website, and we will wrap up with that advisory, not advisory, the safe list. Okay. Thank you everyone for taking time out of your schedule. And I hope you have a great rest of the week.
Thanks. Bye-bye.
Bye, everybody. Good meeting.
Bye.